in arrangements versus carved out arrangements?
You're the expert.
Maybe Amy's the expert here, but it's just, I think, a lot of employers are ingrained that, I work with some big insurance carrier and they give me all the services, the TPA, the insurance, the pharmacy, the telemedicine, and I just buy it off the shelf and I get what I get.
Yep.
And some employers don't understand that, like, hey, they make it easy for you, but they also make it easy for you so they can maximize profitability. And, hide these contract terms away from you, because we have asked some carriers for the contract and they do say this is proprietary or we don't give access to that information. So yes, red flag.
Yep.
Well, and the thing is, if they have everything and it's all bundled into one, it's really hard to chase the dollar or to follow it, Yeah. So when you start to piece out, and you don't have to piece out everything, but if you move the pharmacy benefits to a carve out PBM like VividClear or some of our competitors, you can easily identify trends. You can easily identify where your dollars are going, and you can also easily identify if you're on the PBM side. It gives you access. We give you the keys to our castle.
Right.
So you get access to our system 24/7. You can look at anything. So we're not hiding anything. It's easy to operate. And we're able to make proactive decisions with you as brokers and consultants, and also with the employer in the room. Like, hey, we see this as a potential for you. These are solutions we have. What do you think about that? How do you feel? Do you think your employees are going to jump on board with this, or is this going to be a hard transition?
Wait, you mean you don't just set it and forget it and then let healthcare happen?
Definitely not. It's not our style.
Well, and not only that, the other key thing is you mentioned, yes, you do give us the keys to the castle, and there are other, transparent PBMs out there that we really like. But the other key thing, using the word key, is audit rights.
Absolutely.
I mean, that's the thing you really need to look at. You look at your definitions, and then you look at your terminations, and then you look at the Schedule A. But audit rights. If you're a larger employer, say we want to audit our claims, they say, we're going to charge you for it, or they're going to say we'll bring in our arbitrators. Right. This is not a union negotiation.
Correct.
And I don't want to get too far in the weeds, because I always do this on these podcasts, but I think it's important for us to recognize that we're not talking about the Boeings or the Caterpillars or the Buku companies that are out there. We're talking about the solutions that we're doing together in Iowa and across the Midwest, and really you're doing across the country. We have these solutions that are available. We didn't have 5 years ago, where we can put these solutions in place for smaller employers, companies that are, 10 lives, 10 employees, 20, so we're not talking, above and beyond, 5,000 life contracts. And I think that's really imperative here. That's the other thing that was really attractive for us about what we're doing with your organization is like, we can plug into a level funded plan. So we're able to create our own solution stack.
Well, and I think the question that always gets asked to us is, what size of group are you like really good at? It's like, it doesn't matter.
No.
We are good. We, and a member of the VividClear family, as we refer to members once they join us, the 5 life group is just as important as the 50,000 life group. Yeah. We take excellent care of everyone.
Yeah, from my point of view, it's just like, what's the average employer across the U.S.? They are small employers, and they need good pharmacy solutions, just like the big Buco companies, because, again, it goes back to what we talked about. We need to get people access to their medications at a fair and reasonable cost.
Yeah. That might be a good segue into, not only do we need to have good pharmacy solutions, but we also have to have good access to pharmacists. And so Iowa recently passed a legislation bill called Senate File 383.
Yes,
have you ever heard of it? Oh, you have heard
I
of it.
have.
Oh, yes. Wow. Okay. This is good. I don't have
Vaguely.
I always wanted to educate the pharmacist, but next time maybe. But yeah, so this is, I think it's a wonderful law because, again, as I said earlier, I've watched the slow dismantling of our pharmacy networks across Iowa. I mean, I've been traveling quite a bit in sales, and I remember saying, "Oh, that used to be the movie theater, or that used to be the factory, and that used to be the doctor's office."
Yes, I do know.
You grew up in Newton.
I did grow up in Newton, and I actually worked at an independent pharmacy called
Yeah.
Null and Drug.
Oh, yeah.
With the best pharmacist, Henry Van Elson.
I know, know the
Yep.
name.
He just recently passed away,
Yeah.
but he was an amazing pharmacist, and he was the cornerstone of the Newton community.
Yeah.
And it was a great place to work. And this is going to show my age, but I worked in the independent pharmacy before computers. So Henry would actually type the label on a typewriter.
See, bud.
And we had to keep like the members' history on a card, so you'd have to handwrite it, and then to submit it to the insurance, you would have to type it into this little like credit card box.
Yep.
All of the information. So yeah, I'm
You've probably
getting up there.
probably seen the drug prices evolve since
definitely,
then too.
absolutely.
Yeah. So you're bringing that passion,
Yes, but
right to it.
And independent pharmacy is truly. For some of those, in some areas where independent pharmacies are thriving, really the pharmacist is the access to the healthcare system. I mean, there isn't a doctor, they don't have a hospital in their community. And so really PBM reform is necessary to be able to keep those rural independent pharmacies open and have members in those communities have access to healthcare. And so that was really, I think, the driving force behind the PBM reform movement in Iowa in specific.
Which it's not just happening in Iowa. I mean, it's
Correct.
happening
It's
in other
happened.
states.
Yeah.
Everywhere else. And yeah, I mean, and there's been, how it is when a law passes and everyone takes their position and it just drives you crazy. And, this one in particular, there's just so much misinformation about what this meant. And there's been, just some drama.
Yeah. Viviclear has really tried to, we came to market as a reformed PBM, essentially, if you will. So we most of our practices, well, all of our practices really conformed with the law.
Yeah.
To be frank. So we didn't really have to change a lot of things to comply with the law. The thing that we ran into was the misconception in the pricing changes with the new NADAC plus 1068 versus an AWP model. And so a lot of the numbers that were out there prior to going live were that every prescription was going to increase by 1068. And that just truly isn't the math behind it. So if you look at NADAC as a measuring stick, NADAC pricing is typically lower. It's a lower cost, and that's why you add the dispensing fee onto it. So for our clients, that we did some predicting for, we predicted a negligible increase or in some cases a decrease depending on what their mix of drugs were. And now we've had a few months under our belt, and the increase has actually been less than we initially predicted, but it certainly wasn't all of your prescription total times 1068. That just
So I'm gonna give us the coloring book version of this because this is some of the vernacular I learned in pharmacy school.
okay.
But you have average wholesale price, right? And then
Yes.
you have maximum allowable charge, and those are price lists, kind of like when you go buy a car. You're going to get it's negotiable, right? NADAC is National Acquisition Drug Cost. That is set forth by the Centers of Medicare,
Correct.
CMS. Okay, so to me, that's kind of like the gold standard. And so what that means essentially is the smaller pharmacies, the independent pharmacies, were going to get the NADAC pricing, which was more fair for them to cover their ingredient costs, because
Correct.
that's been the source of them, the bane of their existence, why they closed down, because you hear it on the news all the time. I can't keep my pharmacy open because I'm not getting I'm not able to cover my costs for that medication, right? So, and that's the truth. And so this NADAC pricing that goes into effect, and it has, supposed to, is actually helping those smaller pharmacies because they're actually being able to cover their ingredient costs. And then the 1068 is going to also help them, again, compete with the
Correct.
AWP MAC pricing, which is your big chain pharmacies, right?
Correct.
Your Caremark CVS's and your Walgreens and those folks that I think last year CVS had $120 billion with a B, and they're situs in Bermuda, not Bermuda, Mexico. Okay, Bermuda, New Mexico, not Missouri, but Bermuda. And so, it's a law that has been long overdue in our state, and it's also going to open up the door to more transparency on the rebates.
Absolutely. And, we have clients in other states that have passed PBM reform, and we're seeing exactly what's happening in Iowa, which is, pharmacies are getting reimbursed fairly. And, there may be a small negligible, and I say negligible because if you have one patient go on and a specialty drug, it's going to increase your cost more than this PBM reform is going to increase.
Yeah,
it.
this is not the vivid law. Let's make that clear, because we
No.
have other PBMs that we're dealing with, and we have done the measuring on that, the analytics, and it's a wash.
Correct.
And we're helping our small town pharmacies.
Correct.
Ladies
And,
and gentlemen.
you look at like an independent pharmacy, and even Hy-Vee for that matter, we have 300 retail pharmacies, and you compare them to a Walgreens or a CVS, it's really about the buying power, even a Walmart. So they have nationwide chains that have thousands of pharmacies, and then you have independents that are in a buying group with, maybe 50 other independent pharmacies, and then you have a Hy-Vee that has 300 pharmacies in the nation. And so, it comes down to buying power of the drugs. And so in order to stay in business and even break even, there has to be something that changes as far as reimbursement goes. And, the fact is that the PBMs, bully independent pharmacies into signing really bad contracts, or else they don't get access to those people that are in their communities that they've taken care of for 25 years.
Right. Well, they have what they call movable MAC lists too. So they're I don't know, help me out, you're the expert, but every Thursday they update their MAC lists.
It's updated often.
Yeah.
Yes.
And so what happens is we have this thing called a clawback. Like, we overpaid you last month, so your next check, we're going to go ahead and take the money back that you were supposed to pay us, even though you didn't pay us for it, although we charged you for it. We're actually going to take it out of the money that you're supposed to pay us.
Correct.
Slow
Something like
one
that?
down.
Yeah.
You always are speeding me up on the podcast, so touche.
You're right.
Thanks, bud. Okay. Well, that's kind of a hot topic.
It was.
Yeah.
I am very thrilled that it passed, and obviously there's some litigation going on right now, and it will be ongoing, and I think that's happened in other states as well, and that's okay.
Yeah.
Well, I mean,
so-
if nothing else, hopefully that employers are seeing that in the media,
Yes.
and they're like, okay, well, maybe we should look into this pharmacy thing.
Exactly.
Because they're seeing it on their claims reports if they get access to them.
Yes.
That their pharmacy spend is skyrocketing right now. And
if you don't have a good partner that's saying, hey, we recognize that it's going up, these are some ideas of ways that we can at least just keep it level.
Yeah.
well, let's get into some of those.
I love the reformed PBM though, by the way, because we were going to actually call this the Born Again Broker Show,
Yeah.
but he talked me out of that.
The
But okay,
Well,
born again brokers with the reformed PBM. I don't know.
Well, I mean, community connected health and local pharmacies.
Yeah.
It's
Yeah.
all connected.
Yeah,
It's
exactly.
like, how can we
That's-
continue to just focus on healthcare in our communities and make sure that it's not disconnecting, it's connecting people, because they're going to get the drugs that they need, the care that they need, what's the result of that? Less emergency room visits, probably less hospitalizations, probably. So
less absenteeism.
yeah,
more
we're increasing
productivity.
adherence, all those good things.
Lower
that's
your
happening.
workers' comp claims, because the hip bone's connected to the medication bone is connected to the I tripped over the front door walking into work bone,
Yeah.
because I couldn't afford